let's try to switch back to healthcare, because that's the we sort of went down that on reopening schools in particular. But we get a lot of questions here online, and people are texting, going, "Okay, ask him about X, Y, and Z." But let's see if we can get on back on healthcare a little bit here. What's the mortality like in Virginia? Are we getting better at diagnosing earlier and stopping people from dying from COVID?
Yeah, I think nationally that's happening everywhere, actually, Chris. That there are a couple of things that are happening. One, as we've done better in just addressing some of the issues in the long-term care facilities, the people who are getting COVID now are a younger cohort, and they are just, in some sense, less likely to die. Secondly, there are some better therapeutics, particularly, I think, the steroids, dexamethasone, that's being used earlier on. That's been helpful. Remdesivir seems to be somewhat helpful. And I think people just, the doctors learn pretty quickly. So they've learned in some instances not to use ventilators, that they can actually keep people alive without them. And then when they use ventilators, they've gotten better at their use. And I think that's going to continue on in terms of the therapeutics. And ultimately, I think the big hope here, at least in the short term, is that maybe some of this plasma therapy or antibody therapy might come on board and might actually be very helpful in the next few months. So I think we're doing far better on that front. At the same time, even if people recover from COVID, if they've been on a ventilator, they often have some very serious problems long term that goes on. So we still need to do better on the therapeutics, I think. But I'm confident about that, because I just think the medical community, having again been near them at VCU for 30 years, they're just an extraordinarily impressive group, and they learn very quickly. And my guess is that things are going to get better there over the next 6 months. And then by that time, we're hoping that we find some kind of vaccine that can actually work, particularly with the populations that are most vulnerable.
And then the plasma antibody regimens that will be coming out, people who have had it, who'll be able to donate their plasma as an effective therapy. So it's all everyone's been looking for this silver bullet and all this. There is no silver bullet when it comes to this stuff. It's because everyone's different. Every person's different. Boosting their immune systems. That's going to be a whole shift in our thinking, diet and exercise. Taking vitamin D supplements and the like as a way to boost their immune systems is going to become, I think, an industry into itself.
Right, exactly. And I think, as you said, there's probably unlikely to be a silver bullet for everybody. But by and large, I think we'll get better at treatments and ultimately find a vaccine. And then we'll have to get better at making sure that people get vaccinated, or encouraging them to make the decision to get vaccinated. But by and large, I think, the medical profession learned, and they've learned over the last few months, and they'll continue to learn, and they'll continue to invent things or create treatments that will get us better. But right now, it's still pretty daunting if you wind up in an ICU.
So with respect to the ventilator, the post-ventilator reality for a lot of patients, especially elderly patients who've recovered from COVID but still have potential damage in their heart and lungs. What are the next steps? Are you seeing any in the data that says these people are having problems after that?
Yeah, well, I think what you're seeing is that there's a number of kind of problems that seem to continue to exist for certain people, not for everybody. Some clearly have problems with even if they haven't had asthma, they have lung damage that seems to be relatively long-standing. We don't know whether it's permanent or not. There are some people having issues with cognition. At worst, it's sometimes hallucination, but at other times it's memory lapses and the like, because I think some blood clots have found their way up toward the brain. And so they're continuing, other people have problems with fatigue. It's almost as if they have chronic fatigue symptoms as well. So you have this combination of the people who have died, and then you have the, sort of the living wounded
Right.
there as well. So that's another complication of this disease that seems to make it really different from a normal flu.
But let's talk about that. When we talk about the flu, is this going to help us get better equipped societally to deal with the seasonal flu? Because a lot of people die of the seasonal flu, and it's just sort of like we don't really mention it because it's the flu and we're sort of used to it. But are we going to be able to get earlier detection on flu symptoms to get treatments earlier to prevent this kind of death?
Well, we basically have a shot for the flu if you would take it,
Yeah,
which would.
but people don't.
Yeah, but that's probably the big challenge there is really just sort of getting more people, a larger percentage of people to get the flu shots and to believe that they work, which I think they probably work to certainly limit the extent of the disease in most cases. And we're going to have an a living experiment of that this fall, because one of the things that the CDC director has warned about is a combination of a resurgence of COVID and happening at the same time that flu season occurs. So we'll begin to see whether or not more and more people, a higher percentage of people get the flu shot this fall, given the concern that about this sort of dual threat that could emerge. I might just say anecdotally, I got a call from the Wegmans pharmacy the other day asking me if I wanted to reserve my flu shot this year.
Okay.
Which I did.
I would imagine these days.
And they told me they'll call me when they have it ready. So clearly there are some people and some pharmacies that are preparing for this and are expecting to have a larger demand for flu shots this season. I might also add that the accounting for a flu death is very different than the accounting for a COVID death. That the flu death typically have at the end of the year, they make an estimate. They take the number of people who have been diagnosed and have clearly died with the flu, and then they put a multiplier in there. It's like almost like an economic impact statement. They say then the multiplier. This is the number of people who must have died from the flu.
Well, that's asinine. I mean, we have the technology to say there should be an app that says, "Yep, he died of the flu." Click the button and they total it up. This is not difficult in the 21st century.
Well, but that's if you take a look at how flu deaths are measured and how COVID deaths are measured, because I looked at this because there was all kinds of folks saying, well, there's many people die from the flu as die from COVID. And then I basically began to look at what the methods were for determining who died from the flu. And there's a pretty significant multiplier that is attached to the actual number of people who were diagnosed and clearly were, died in the hospital from a flu. Whereas the COVID deaths are far more, noted as probable and suspected COVID deaths, and there's not a multiplier that's attached to the end of it. So that's what will happen at the end of this, at the end of the pandemic. There will be people who will come along and say, these are the number of people who probably died. Now, you may have seen the other day, to complicate the matter a little further, there's this extraordinary doctor at VCU, Steve Wolf, who may be the nation's leader in looking at, sort of mortality rates and death rates. And in particular, what he has done over the last 5 or 6 years prior to COVID is that he's looked at death rates by zip codes to really show sort of what turns to be this tremendous economic class divide in the United States by where you die. If you live in Southwest Virginia, your mortality rate is far higher. Just in general, you die at a lower age than if you live in Fairfax County and the like. And so now he, over this week, he published a piece, I think in the Journal of the American Medical Association, looking at excess deaths with respect to COVID. And so what he found is that there's been a significant number of what he calls excess deaths over what you have seen per year, some of which may be associated with COVID, and others which may be associated with people not going to the hospital for treatment of various kinds of chronic diseases that they already had. So we've seen this, other complication that's now arisen, that we have deaths from COVID, and then we have deaths from people who may not have gone in for the kind of treatment they should have gone because of, their reasoning about what was happening with COVID.